Looking for a doctor? Urgent Care 360 Plus Family Medicine. Visit us today at 33 to 35 Beckford Street, Unit 10 to 11, Beckford Shopping Center, Savannah, LA Mar, Westmoreland.
This is Dr. Hugh Elliott, Urgent Care 360 Plus Family Medicine. I am a general physician, CEO, and managing director. So today we're going to talk about leptospirosis, what it is, and the implications it has for Jamaica. So overall, leptospirosis is an infectious disease, and it is formed by a bacteria that likes water. So it likes to be in contaminated water. So it lives in the soil, it lives in anything that's moist. It's usually found in the kidneys of infected animals. The other names that are usually out there is like rat fever, field fever, mud fever, cane field fever. So in general, it affects the humans by entering the body, and there are certain ways it can enter into the body. But the main source of the infection is a rat. Other sources can also include cattle, animals, dogs, or even wild animals. And it's something that is very important for us to know in the light of what happened recently, where we have the hurricane, aka the storm that passed. So a lot of water is around, and this now causes the bacteria to be spread very easily. And we have now heard that there is an outbreak of leptospirosis in Jamaica. So in general, the infected animals, as I said before, carries the infection in their kidneys, and usually, and sometimes they're not unwell. In general, globally, we have about 1 million cases with approximately 60,000 deaths globally. And that is significant, especially the fact of the matter that we are actually having a number of deaths here in Jamaica as we speak. So what really happens? Because the bacteria is aquatic, it means that it can spread into the surface of the water. Now, as we have heavy rainfalls or after a hurricane event, because there's a lot of water, the bacteria then spreads into different areas, right? There has been other outbreaks in the past. Namely, 1998, there was an outbreak in Peru and Ecuador as well. So this is not isolated cases. It usually happens after heavy rainfalls, aka storms as well. So the reality of the situation is this. You have a rodent, normally the carrier, which is the rat. It pees, in general, goes into the waterways. Then sometimes it can be from there that the humans are infected, or it can then infect animals, and then the animals pass that into another waterway, and then humans are infected, right? So the bacteria, from a perspective of what it looks like, it's a corkscrew shape. It's a gram negative, just for those from a standpoint of those who would like to know, and it's also aerobic bacteria. Species are 21, and 13 have been identified in human cases. So how do we get it in general? Through a broken skin where the water or soil or vegetation is contaminated. It can also pass through the mucous membrane, the eyes, the nose, the mouth. So again, have to be very careful. There has been person-to-person transmission, sexual contact, breastfeeding, or even possibly through pregnancy as well. Bites from the animals, for sure. We want to make sure that if the animals are infected, or better yet, just don't get any bites in general. So number of risk factors, but the huge risk factors for us right now, or is the risk factor for us in Jamaica right now, is the fact that there has been just a lot of water around, surface water that has been settled, and we know that these rats are around as well. So planting, hunting, are general ways you can get it. Butchering, harvesting, bathing, especially now a lot of people don't have water in Jamaica, so we use the rivers and other areas to bathe, and that's also a source for getting the bacteria. Symptoms, which is very important. Now, this is where the medical aspect comes in. Incubation period is usually 7 to 12 days. It means that once you're infected, it takes around that time for you to start having the symptoms. But it can range anywhere from 3 days to 30 days. That is very important for us to know. So it means that once you've been infected, you might not have the symptoms for 3 days or up to 30 days. The symptoms are very much non-specific. meaning you can get a fever, you can get chills, you can get headache, abdominal pain, red eyes, pain to the muscles, yellowing of the eyes as well, and also the skin, which happens in other infections as well. So the main thing with these is that you have to look out for these symptoms. Once you have those symptoms or any symptoms at all, find your doctor, find your medical doctor. We are in SAV, Urgent Care 360. We're uptown Beckford Shopping Center, or just find a medical doctor. If you are feeling very unwell, then seek medical attention straight to the hospital if necessary, or your nearest urgent care. So that is something that is very, very important for anyone to basically make sure that if they're having those symptoms, because those symptoms could be anything, but especially in light of what's happening now and possible exposure, certainly find your doctor. And again, leptospirosis is a very serious disease. It is something that can be treated, and the best thing is to get treatment very, very early, because it is something that can also affect all the other systems, and we have known of cases of people who have died. Thank you very much for your time, and we look forward to seeing you at Urgent Care 360 Plus Family Medicine. Thank you, and have a good day.